Good evening and welcome to the E.ON's Young Cancer Nurses Nightingale Challenge webinar number 3. The topic for tonight's discussions are on secondhand smoking, and we've got some fantastic speakers lined up. My name is Constance and I am a young cancer nurse representative from the United Kingdom. I work as a matron at the Royal Marsden in London and have a background in advanced practice in acute oncology. And have completed a master's and am a non-medical prescriber. So we are joined tonight by two fantastic speakers, Krista Rustler and Dr. Lena Sharp, and it's my pleasure to introduce Dr. Lena now. So she is a nurse and researcher from Sweden. She currently works as the head of cancer care improvement at the Regional Cancer Centre in Stockholm. Lena was previously the chief nursing officer and patient safety coordinator. Oh, my screen's just gone. At the Department of Oncology at Krakowski University Hospital, and has a long experience in cancer nursing, clinical work, leadership, teaching and research. Her main research focus is healthcare communication and patient safety. Lena has a PhD from the Karolinska Institute, Sweden, and moreover, Lena is the E.ON's former president, advocacy working group member and leader of the Pre-Can project. So I'm going to hand over to Lena now. Any questions, please leave them in the chat box below, and I hope you'll enjoy the session.
Thank you very much, Constance, and thank you to the Young Cancer Nurses for inviting me to this webinar, which is on smoking cessation and secondhand smoking. Thank you so much, and also for the nice introduction. I will start to talk a little bit about the PrevCan initiative, which is a big on-take from E.ON's about cancer prevention across Europe. It got 3 parts. It's a massive cancer prevention campaign that is ongoing. We are arranging this campaign for a full year with 12 different themes for each of the month, and we are in the 2nd month right now. But PrevCan can also have research and education components, and I'm going to report a little bit about the research when it comes to secondhand smoking. So we will, in this project, we want to reach the wider proportion of Europe with evidence-based, reliable information on how people could reduce the risk of cancer. We want to raise awareness and knowledge among basically everyone. We want to reach the general public, specifically vulnerable groups, our patient, healthcare professionals like today, and also political stakeholders. So this is a massive project, but really, really interesting. So the basis for PrevCan is the European Code Against Cancer, which is developed by the EARC, which is the International Agency for Research on Cancer in the WHO, and this was a task they got from the European Commission to develop this code. And during November now, we are in the 2nd month of the campaign, which is about secondhand smoking. So the advice in the code is to make your home smoke-free and to support smoke-free policies within your workplace. So that's what we're working on right now. But it's not easy to reach out with information and recommendation on cancer prevention, but the code is developed just so individuals in Europe could take actions to help prevent cancer themselves. But if you should be successful with cancer prevention, it also requires support from government policies and actions, of course. And we also want the recommendations to be evidence-based, and also it needs to provide scientific justification, which it does in the code. It's actually quite a good resource for all the sort of research behind the different recommendations. Is there and explains for you. So that's really good, I think. The problems, though, is that most Europeans are aware of this code, and also many healthcare providers. Another thing that is the reason why we develop PrevCan is that people need support alongside the recommendations. So giving 12 recommendations is not enough for people to change lifestyle, etc. So we need to combine that with some solid support. But moving over to secondhand smoking as a risk factor for cancer, I will start with saying that there's actually no risk-free level or safe level of secondhand smoking. So we really have to try to avoid this as much as we possibly can. We know so much more today than just a few years ago. We know the strong association with secondhand smoking and lung cancer and also other diseases. And actually there is some evidence today, even if it's not as strong as with lung cancer, but there is some connection for other types of cancers, like some of the head and neck cancer, and also breast and hematological cancers. We also know that patients with non-small cell lung cancer exposed to secondhand smoking have poorer outcomes from their cancer treatment, including survival. So that is also a reason why, even when people are affected by cancer, we as cancer nurses need to continue being aware and work with this risk factor. We also know that secondhand smoking exposure increased the overall risk for all cancers among never smokers. And a conclusion from a large prospective US study showed that a reduction of secondhand smoking reduces the risks of all types of smoke-related cancers. So this is really an important topic. And you might have seen this figure before. On the left, it shows all the effects that some of the, well, I guess most of us know quite a lot about the effects on smoking on an individual, but here on the right-hand side, you also see some of the effects by secondhand smoking. So that's also something we have to consider. And we do know that less healthcare professionals are aware of this. So you can ask yourself, how large is this problem? Well, it is quite large, even if it's difficult to make evaluation and estimations here, how many people that are exposed to secondhand smoking at home. It varies a lot, of course, between the countries, between different communities, between different families, etc., and generations. But overall, it's estimated that about 1/3 of the European population is exposed to secondhand smoking at home. We also know that non-smokers, people who never smoked or have not current smokers, exposed to secondhand smoking at home or at work, they increase the risk of developing lung cancer by 20 to 30%. We also know that in some European countries, smoking in the workplace is still allowed. And I would also challenge the countries like my own, Sweden, where smoking is not allowed at workplaces. There is still workplaces that you have smoke. For instance, our colleagues in home care, for instance, you go home to somebody, there's no rules that these people can't be smoking in their own homes. So there's still professions like healthcare professions and others that are being exposed, even if we have quite strict regulations on workplace policies. And also during the last few years, something called third-hand smoke has also been starting to be discussed. On this illustration you see here, I've cut that in from the WHO homepage. They talk about it quite a lot there. And this is nicotine and other chemicals, including cancer-causing chemicals from tobacco smoke that stick to surfaces indoors, but also to your hair and to your skin, etc. And it can linger for weeks or months even, and it can actually re-enter the air again. And of course, we don't know enough. This is not studied in detail, but as you can see on these illustrations, WHO are quite strict about it and really encourage people to try to avoid this third-hand smoke as much as possible as well. And it's also pointed out that children and pets may be most vulnerable, maybe not so surprising. So if we look at secondhand smoking across Europe, I found this recent study that it's a survey from 6 different countries. It's Germany, it's Spain, it's Greece, Poland, Hungary, and Romania. And they've done a survey among 2 cohorts of people in these countries. It's self-reported exposure on secondhand smoking. The first cohort was 2016 and the second one was 2018. And they compared and saw a significant decrease in exposure at work from 19 to 14%, but still 14% say that they on a daily basis get exposed to secondhand smoking. They found no significant difference in secondhand smoking exposure in bars, restaurants, and nightclubs. But I think one of the most important results of this study was that secondhand smoking exposure in public places was significantly less likely in the countries that had total bans for smoking in public places compared to countries with partial bans. So regulations and bans, I'm sure Krista would talk about that as well. That is something that really works. I want to talk to you a little bit about the PrevCan focus group study that we are, Nicolina, who's here online tonight, and I think Kiliana Ulgren as well. The three of us are currently working on the analysis of this interesting study. It's we have performed focus groups with different vulnerable groups, and here I will present some preliminary findings on secondhand smoking exposure. So what does these 4 groups say about secondhand smoking and the risk of being exposed? So first, we had different focus groups with people with learning disabilities, which we know it's one of those groups hard to reach with health information. And they were extremely aware of the risks with secondhand smoking in this study, actually, but they also raised concern about being exposed from staff around them, smoking in their homes or around their homes, etc. So that was a risk that they really saw. And then we had focus groups with young people without own cancer experience, and they may be aware of it, not all of them, but they don't see the risk as relevant or realistic for them, or some of them didn't. So this is one quote from one of those groups that said it's not a guarantee that something really bad is going to happen. So then it doesn't become really real to young people, being immortal, as you know. And then we also had focus groups with immigrants moving from some part of the world to another, to a EU country. And they were aware of risks with smoking, but not so much about secondhand smoking when it came to cancer risk. They were talking more about e-cigarettes and water pipes, which was a big deal in these focus groups. And also we had focus group with young cancer survivors, and we found them being particularly vulnerable to secondhand smoking. And some of them in this focus group actually said they didn't know anyone that did not smoke in their family or among the friends. There was examples of people in this group sharing experience of when they were fighting cancer and not being able to avoid secondhand smoking, which is really, really sad, I think. And here is a quote from a woman that a young woman that is a cancer survivor, and she's in the follow-up phase after her treatment. And she says that every cell in my body fights so much for me to be healthy. And if they would understand, maybe they could leave it and emphasize with me, but I don't know how to tell them. And she was actually putting it on herself. Could she do anything more? Which I think it's really painful to hear, that you think it's up to the individual and it's not up to the surroundings to do something about this. And if we look at the general findings so far, this is preliminary data, as I said, but across the groups, we see that cancer prevention information needs to have a more positive approach rather than telling people what they can't do. We need to tell them what they can do. So focus on opportunity rather than warnings. And I think secondhand smoking is a good example. Here we can actually, it's something we really can impact all of us to make sure that we all are not exposed to secondhand smoking at all, actually. And we all know, of course, that children and young people are particularly at risk. We can make sure that all children are being brought up in smoke-free environments. We know that exposure during childhood increased the risk for lung cancer in adulthood. And also these children that are exposed at home, they get sick more often, they have more lung infections, more symptoms, more ear infections, etc. And this has been highlighted by the EU in the EU Beating Cancer Plan, actually. So EU support the tobacco-free generation, where they have set a goal that less than 5% of the populations in Europe should use tobacco by 2040, compared to about 25% today. So we have a lot of work to do here. So what can we do? Well, we can ask about secondhand smoking exposure among our patients and their families, and we can provide advice and support. We can also follow up. We can use the teachable moment that we see in healthcare when we meet patients and their families, maybe about other things. We can use that moment, that teachable moment, to discuss and give them recommendations to avoid secondhand smoking as well, because most people don't know that that's actually a cancer risks. And we can also communicate in general on secondhand smoking as a risk factor for cancer and other diseases, because as nurses, we are very trusted, and what we say to the public and what do we say to our surroundings is actually something that people are listening to. So we have a big responsibility here. And this is one of the messages that we try to share in the PrevCan project, and that is that both if you're a smoker or a non-smoker, you should stop smoking in your home, in your car, and in your workplace. And if all of us did that, actually we will reduce the level of secondhand smoking quite a lot. And then I would just want to ask you if your workplaces are completely smoke-free. I'm sure I'm not the only one that see both patients and families, visitors and staff members smoking, just maybe not in the hospitals anymore, but just outside, and members of staff coming in smelling of smoke into their units, which is really not acceptable. So I think here we have to point out the risks and request improvements if it's needed, if you think it's needed, and demand completely smoke-free workplaces, because all healthcare organizations, and as I see it, they need to protect both their patients, their visitor, and employers from exposure to secondhand smoking. And also, as healthcare professionals, we are role models, and we need to act as role models. So we need to look after our own health, and in that is to make sure that we don't get exposed to secondhand smoke ourselves either. So finally, I just want to encourage you all to follow us and share and communicate on PrevCan. Here is the address to the webpage if you haven't seen it. We have over 65 organizations across Europe taking part of this campaign. So let's work together and try to share this and communicate as much as we can about secondhand smoking as a risk factor for cancer. Thank you very much.
So, thank you so much, Dr. Lena Sharp. I want to present myself. I'm Sarah from Portugal. I'm working with cancer patients since 2014. It started in Frankfurt and then Berlin and then back to Portugal. I'm doing my master degree with the team oxaliplatin-induced peripheral neuropathy in diabetic patients. I really want to introduce you the next speaker, Krista Rustler, registered nurse with a bachelor in health communication and European health promotion and health management. At the time, she's managing. She's a managing director of the German Network for Tobacco-Free Healthcare Service, which received awards from World Health Organization World No Tobacco Day Awards in 2021. She also leads projects to implement international standards of tobacco prevention and cessation support in healthcare in Germany since 2005. And also she was a founding member of the Global Network. Yes.
Thank you very much, Sarah, for introducing myself, and thank you to the Young Cancer Nurses for inviting me. And I'm really proud to be here, and it was great to listen to Lena, and I'm looking forward to your questions and to our discussion on what we have to do, or what as a nurse we can do to prevent our patients or people around us from tobacco smoke, or also from to do tobacco prevention or tobacco cessation. So I was invited to talk about cessation as a support to smoking people, and to see it as that it is the best as a secondhand smoke prevention. And I would like to encourage you to make it happen and also to make it work. And I love to share some experiences from my work in the network and in healthcare services, and for nurses and with nurses. So it was already said that I'm working in Germany, and sadly I have to tell you that the tobacco control in Germany, according to the tobacco control scale from 2020 or 2019, we are holding the last place in tobacco control measures, political measures against tobacco consumption or against the tobacco industry. And well, we are there where we are needed most, so it's a challenge for us. And I thought, you know, when we are at the last place, the only way to go forward is to go up. But you see the question mark, so I'm not sure where we will be on the 2nd of December. The next tobacco control scale will be published, and I will see where we will find us. But it's no reason to give up. We need to work on that. And as Lena said, it's the tobacco control policies around us that support us to do our work. So we need to work on all levels, not only on the individual, but also on the organizational level, and also on the political or on the professional political level. What are we doing? We support the National Health Target of reduction of tobacco consumption. And our job is mainly to support the implementation of tobacco prevention and cessation, because I think we know or research knows all about how to do it and what is really dangerous and what is not good for us. But how to bring it into daily practice is really a challenge. And the implementation support is a great opportunity for nurses, because in my experience, nurses know more of the organization and how it works than any other profession. So I would like to encourage you to be a change agent in your organization and try to support new processes. Yes, and we got the World No Tobacco Day Award last year, and I think it's a hint to tell us you have to do better. So it's a challenge and also a high recognition for us, as we are seen as an important network to support tobacco control in Germany. You know everything about this. So tobacco smoking is the greatest preventable risk. And the message is that we should treat the cause, it's the nicotine addiction, and not only the consequences of the consumption. So the tobacco industry is very active in promoting their new nicotine products, but many of the people are not able to switch completely, and so they stay still addicted. And the addiction is also causing health inequalities, because it's high costs and it's not easy to get off the nicotine. It's really a very severe addiction. And as Lena said, you know, each contact with a healthcare professional is a teachable moment. So we should use these teachable moments and talk about it in a good way and address smoking. And I would like to remind you that if you help one person to stop, you promote the health of all around them. And it's a success experience for all of them, and not only for the patient and the relatives and the partners or the family. It's also a success experience for ourselves, for how we could support a smoking person to quit and to start a healthier life. So I think that we should talk a lot about how we can help and how successful we are in supporting people, helping to quit smoking. And sometimes it needs a start to talk about that. So in healthcare, we reach a high proportion of tobacco and nicotine user, even if they develop severe illnesses, and healthcare services are also settings where education and socialization for the professionals happens. So what they see in their daily practice, they will continue to do. So it's really to make a change in some areas. So smoking at the cancer patient. So because it is a risk of cancer, a lot of patients smoke at the time of the diagnosis. And about 30% of those continue to smoke after the diagnosis. And those who can become abstinent relapse, and especially women with, I always struggle with that word, gynecological tumors. And I think it's worth to think about why women with this kind of tumors have it so hard to quit. And so we are also in a group of Women Against Tobacco to find out what kind of support women can need or women can get different maybe from men. So the predictors of willingness to quit is a higher confidence in the ability to quit. And I think this is something that nurses can really support, to give them hope, to show them the way out of the addiction, to give them practical support and, give them a perspective. And so to raise this confidence in the ability is something that nurses can do day by day. And yes, if the diagnosis is related to smoking, then there is a high motivation to quit. And so we should not leave the patient alone with this motivation and with this worries. So even some doctors tell me, well, now they have a cancer diagnosis, we leave them with the smoke if they like it, but they forget that, quit smoking helps to increase the prognosis, the quality of life, and the survival rates, especially in lung cancer. So there's always a good reason to quit smoking and to give the patient the chance, even after the cancer diagnosis, to quit. And it's also recommended in the S3 guidelines. And this is a new one in Germany. And I just picked up the main recommendations. So tobacco cessation during hospitalization, tobacco cessation in lung cancer, and not only in lung cancer, and tobacco cessation also in screening for lung cancer or in cancer screening at all. It's a good teachable moment to talk about smoking and to offer opportunities to quit and give them, raise the confidence that it's a possibility and they are able to quit. So maybe you know the ABC of the cessation support, and I would like to introduce you to the smoke-free ticket, or in German, the Rauchfrei ticket of the German Federal Organization of Health Education. So we are doing a project to implement that ABC and the referral to the quit line in hospitals, because we know that under the high workload, it's sometimes not easy to have a complete cessation support, also with the short length of stay in hospitals. So the referral to a quit line is the first great step to give patients access to a helpful quit support. So the message is: ask all patients about tobacco and nicotine use and document that. Give a brief advice and give and offer help. It's not only to tell them, you know, it would be good to stop smoking, but it's also, it's more important to tell them how they can have help, what kind of help is available, and how they can have access to it. And also document it. Everything what is documented raises awareness on this topic. And cessation support is referred to a quit line or a cessation service. If you're interested, the WHO has a collection of worldwide quit lines in the website. And even if you have somebody who is not speaking your language of your national quit line, you can support them with a phone number or a website from all over the world. So the question is sometimes how to talk about tobacco use and quit support. And the best is to start the conversation and offering help. So, and start the conversation with an open question. So like, maybe you find your own words, but I would like to try or give you kind of an idea on. And the first question could be, may I ask you, how are you feeling about your smoking? What do you think about it? So it's not the first question, you know, it's not good for you and it will cause this and that. So it's asking the patient, how do you think yourself about it? And most of the people will start on their plans and how often they tried. And so that gives you a good opportunity to start the conversation on a very positive way. Or you can continue with, you have probably already thought about quitting, so that would be really good at the moment. And we have an effective treatment for that, and we can support you in your quitting process. And then to support the motivation and refer to a quit support. So it can be like quit smoking is one of the most important measures to support your treatment, or that counseling and pharmaceutical support is very effective and will increase your chances to quit. Many of the smokers with a cancer diagnosis have tried many times, but maybe just on their own. And if you try to quit smoking on your own, the quit rates are up to 3 to 7%. So it's very low after 12 months. 93 to 97% of the smokers had relapsed. With the quit support, it's up to 30 to 40, maybe to 50%. So every second person has a chance to quit smoking, especially in those situations, and especially with the support or using that teachable moment in this situation. So give them a chance. And so the question, what about an appointment with our quit support? What do you think? This is really an open question. It's discussed in some situations. It depends on the culture of the country and in the culture of the hospital to have an opt-in or an opt-out question, like, this is our support after your treatment here, and you will get a call from the quit line and they will support you through the process and give you a better chance. Or the open question and say, what do you think? Can I offer you a treatment? So sometimes I explain to our colleagues, you know, if you have a hip replacement, I think it's quite normal to offer them a physical therapy. And it's not, if you would like to, we could offer you a physical therapy. It's, you know, this is the treatment that follow up your situation in the moment. So it depends a little bit. So the next topic is tobacco cessation is a team issue. And we ask in the training, so what are good opportunities in your daily practice to offer a quit support, and who is involved in that? And who do you need to support a whole process in supporting patients to quit? And the quit support process in a clinical process is the assessment of tobacco use, the brief intervention, optional clinical tobacco cessation services, the referral to the quit line, and the follow-up. And I can show you some practical examples. This is from a lung cancer, and tobacco cessation is mandatory for the accreditation as a lung cancer. So at the admission, it's done by physician and nurses. And there's a brief intervention done by physician and nurses through the hospital stay, and the referral to a quit line, if the patient agrees, is done or recommended. And 2 times weekly, the senior physician comes and review if this is really done. And so he supports the implementation of this process. So everybody is active in it. And there is a secretary that supports the team to do the administration work. And what we do is a weekly feedback on the hospitals who take part in the implementation, so they can see how many patients are sent from or referred from our hospital to the quit line. So they have a feedback on the success and how it works. This implementation process is not only the individual ABC and talking to the patient. It needs a team and a strategy of the organization. So the hint is to increase information about the benefits of smoking cessation with the colleagues. So there's a commitment raising and check with the leaders. Are we ready for an implementation change? Can we do it now, or is it better to wait until, let's say, after the new year? So to start a new process, so you have the support of the strategic leaders. And so to assign also an implementation team supports the change in the daily practice for the implementation. The implementation process itself is communication and training to inform the people, to give them a good practice examples, to train them to create an implementation process like I had showed you, and also to have a tobacco-free environment to denormalize tobacco use itself. That raises the motivation and also the picture of a smoke-free life. And also monitoring of progress and results is necessary to have to react if it's not working, or most of all to see the success and give a feedback to your colleagues how good they are doing in referring to the quit line or to cessation services. The networking is a long-term support for changing daily practice. So what we offer in the network is we exchange good practice in a monthly meeting. We offer a peer review for cancer centers or for hospitals following the international standards. This is also a recognition and a certification process. So make people proud about that, what they are doing. And we build alliances to support advocacy on the political level with networks and AONS today and the Coalition of Nurses and Healthcare Workers. And if you are looking for colleagues in tobacco control, I can recommend the Coalition of Nurses and Healthcare Professionals Against Tobacco and Nicotine Products. That had started in the European Conference, Tobacco or Health, in 2020 in Berlin. And during the pandemic, we met online and created a working paper. And the role of the nurses is described in there, but we also include other health professionals. And the mission is to contribute a tobacco endgame of stopping the consumption of all products containing tobacco and nicotine in Europe. And one objective is to support healthcare professionals, like said, they are smoking themselves, to stop using tobacco and nicotine products, and to have that professional work to support tobacco control and involve nurses and other healthcare professionals in tobacco control strategies and initiatives. And if you're interested, please get in contact. I hope that we can continue with online meetings, and we had a great symposium in Germany in the National Tobacco Control Conference. So never stop about becoming smoke-free, and sometimes it's like a great dragon produces a lot of smoke and fire, but never stop talking about it will help you to increase the community that provides a tobacco-free life. Thank you for your attention.
Thank you, Krista. Thank you so much for this great presentation. I will suggest to check out the chat, and I will see if there is any questions. Because we are still speaking with Krista, I will maybe start with the questions for Krista. So I see there. Bethany Maynard, she's asking, what arguments, advice can you give in response to "I have cancer, this is the only thing I have left to enjoy"? And the other question, she makes two. If someone refuses cessation support, what's the best way of further exploring the topic or convincing them to stop?
Thank you for those important questions. I think that keep us really busy because, you know, like I said, it's such an important intervention to support people stop smoking. But what if someone has a problem to give up this, what brings maybe a lot of comfort in a very difficult situation? And I think the first thing is, how do I feel about when a patient is not taking up a recommendation? So I think it's not in every situation, even for us, easy to take a recommendation that someone else with a really good thought is trying to help us. So the main message or what I think is we should stay a partner in communication. So don't stop talking about it, even if the patient is not ready to listen. I think it's maybe in this moment a no, and if we insist, it will stay a no. It will end the conversation. But if we understand and say maybe in the same words, well, yes, it's really a hard time, and that's just a relief for a moment, and then he maybe will, or she will maybe continue to talk about what is good, and then we can ask, what else is then good in your life? And so talk about what's really in their heart and in their mind, and because they will make the decision. It's not our decision. So our decision is to make the offer, but not to, it's not our decision if they quit or not. Maybe a personal thought. So my father died on lung cancer, and he smoked until the last minute. So it was not possible.
Lena, do you want to add anything to that? Anything else? Any other thoughts?
No, I totally agree with Krista, and I mean it's to not being judgmental at all. It's up to the individual to decide, but it's to ask, even asking a patient if they're smoking, you will get a reaction. After working with smoking cessation in cancer care for many years, I know you get surprised by that, just that question. Some patients come back to you and say, you know, you asked me last time and I've been thinking about that. And so it's about asking questions without being judgmental And also another thing is to leave the door open is what so you can always say, well, if you're not ready to talk about it, if you change your mind, you can come back to me. So you're showing people that you're willing to talk about it and you're not going to tell them off, because most smokers are being told off by society and healthcare so many times they don't want to do it again. So I think that's probably the most important.
So I guess it's kind of along a similar line, a question probably for both of you, but if we go to Lena first. So you both talked about a teachable moment and to find that teachable moment. Have you got any advice that you could give young cancer nurses in specifically about either finding that teachable moment, how to keep that door open, or when they're trying to have these kind of, I think it's a challenging conversation fundamentally, and any advice that you'd give young cancer nurses, maybe you haven't had such a challenging conversation before, what advice you'd give them?
Well, I think it is sometimes we put too much complication into what is a teachable moment, because when I want to challenge nurses is that we talk about urine and bowels and poo and everything with our patients, but we struggle to ask about lifestyle. So first of all, I think it's a lot in us that we were so worried that we're going to get a negative reaction, but actually there is quite a bit of research showing that patients see questions on lifestyle as a quality mark on healthcare. So it's sometimes more in us than in the patient. So I think that's, and of course, if somebody is in bed with loads of pain and worry, you don't come with a question about smoking. You know instinctively as a nurse that it's no point that I'm going to talk about smoking right now, because this is not the teachable moment. But teachable moment can also be about family members, because there is also research showing, for instance, that if a family member is affected, the people around them, like Krista also said, also are affected, and that's a teachable moment for them. You can only go to yourself if something have happened to a close family member, you're really concerned about health. And I mean, the whole pandemic shows us that people today are more, even if we seem to forget about everything right now, we are concerned about our health and want to do a lot to make our life healthier. So I think we know, it's just we need to try once and you see it's not so difficult.
I think that's good advice. Krista, anything to add?
You had asked me something?
Yeah, just anything you want to add to Lena, what she said, and anything about finding that teachable moment for young cancer nurses?
Oh yes. I heard a wonderful speech of somebody, and he said, and that always reminds me on the teachable moments, that we should try to get we should get the time back. You know, a teachable moment is something you can't create. It's when the patient asks you something, what do you think about this? I think this is the best teachable moment. And we should have then at least a few minutes to, to be really aware of what is the question about, and not say, I will come back in an hour. So to get these moments, and sometimes, well, this is a nurse's job, during the nights, or when it's a little bit more quiet in the evenings, or when you bring somebody to another ward, and then there are that moments, and it's not the psychological setting, but sometimes it's the most important question, helping somebody, even at the toilet, and then the question comes up, and to be really proud that somebody is sharing important thoughts and maybe opens a door, and then you are the partner to start a conversation about something that can really change the life of the person. And I would like to support what Lena said. At the moment, you may may get a no, but it will take, they will take that sentence with them for months and for years maybe, and they never will, or some never forget a good support in a difficult situation, and that brings the change maybe later on. If you talk to ex-smokers, they know exactly what sentences around them help them.
I think that's very true. And I think what's really interesting as well is what you said. I'd never thought of it from the perspective of the family. And actually that secondhand smoking is sometimes a lot of people say that juggling like a cancer diagnosis and smoking, is that the right time to talk about it? And actually, I think it was really good the way that you framed it as actually thinking about the family and the impact that that has on the rest of the family's health, not just the patient. So yeah, keeping that door open. Sarah, do you want to? Sorry, I can talk for England. You take over.
No problem. I was checking here in the chat, and somebody wanted to ask about eco-cigarettes. How harmful are they? Does anybody wants to answer that?
I think I'm leaving.
I think this is the electronic cigarettes. Yeah.
Well, I think the best is to look at the at your evidence or at your guidelines. What in your country is at the moment the state of or evidence based. There are more and more studies. There are more and more studies who are really skeptical about if this is really a support to quit smoking or to quit tobacco. As I said before, the tobacco industry wants to keep up their business, and so they promote that as a risk-reduced product. The heat no burn, there's still tobacco heated up and inhaled, and if this this vape comes to a lung that already was damaged by smoking, then the risk is not clear. We have no long-term research on that. And just recently, more and more skeptical research is coming up. And I always say, if you have a drug dealer and he sells now a better drug or a cleaner drug, you would not recommend him taking the drug, or have this as a health professionals recommend to take a drug from a dealer. We have, if we use evidence-based interventions and the pharmaceutical support, we have so many tools to support the patients on a very, very good basis. So on the other hand, it's then up to the patient what he chooses. So we can support with a good information. In Germany, it's not supported to recommend a non-medical product from the industry that it's not proven.
And I can add just that I totally agree with what Krista says, and we don't know the long-term effect yet because it's not been around that long. And if we even start to see health effect of third-hand smoking, you can imagine that we should probably not recommend smoking something at all.
I think that's where my allegiance lies.
Mm-hmm.
There's a question about, Lena, about in your kind of, how often do cancer patients stop smoking when diagnosed, and do they? Have you got experience of successful kind of smoking cessation during a cancer diagnosis, or what's been your experience of it?
Well, I did a study, it's quite a few years back now, but I mean, there's plenty of evidence for nurse-led smoking cessation during cancer treatment and diagnosis, that's for sure. And I did a study on head and neck cancer patients, and actually we reached 75% tested smoke-free patients after 1 year. So you can do it. It's a lot of work, but sometimes it even works better with the really, heavy smokers, that if you really believe in them and help them and you build a relationship, it really can work. So it's definitely something that are effective. But to the question, how many that stop smoking, it depends on what support they get and how much information they get. So, and I would say something, not saying anything, not even asking if people smoke, that is also leaving a message. Then you leave a message, this is not important, it's not an important issue. So not pushing people, but asking them if they smoke, and if they're in any way open to communicate about it, you give advice and you inform what in this specific situation, why is it important? You don't need to tell them it's dangerous to smoke. Everybody knows that. It's why is it important in this situation? You come a long way.
I think that's really good advice.
I think it's great, when I would like to encourage you just to start, because if you get the experience how thankful patients are and how great it feels that you can help, and then the more you are convinced by yourself that it is a good thing to do, the more impact you have on your patient. So be strong in that. And I think the figures you said, Lena, that's great. I think it's sometimes, it's quite opposite to the other saying that, oh, it's now they have cancer, it's better not to do something. It's incredible what kind of energy and ability people show when they get the right support.
I am very curious about the European Code Against Cancer. What can we expect for next activities? Can we know that, Lena?
Yes, thank you for the question. Yes, the next month is December, and it's about another difficult issue, and that's maintaining a healthy body weight, whatever that means. So we are actually preparing, Johan de Munter, which is E.ON's president, and I are actually emailing during this session about, will promote a specific challenge for healthcare staff to think about weight and waistlines and reducing weight, because we know it's a big problem among healthcare providers. During January, we will have some specific activities on physical activity, and then diet, risks at work. We're planning a big campaign on screening in the end of the campaign, which is next fall, and also about increasing uptake on HPV vaccination programs, etc. So stay tuned and you will get a lot of different campaign activities coming your way.
Very nice.
Yes.
I think I will.
For your message, even doing it's a bit unfortunate, but there you go. It's like I say, it's not what you eat between Christmas and New Year, it's what you eat between New Year and Christmas.
So I will. I think we have a couple of minutes, 2 minutes or something until 6. But I want also to invite the audience for the next EONs about early breast cancer webinars. I think there will be a flyer right now to show you. You have to check in and see the dates that with the teams that you want to hear about it. And I also want to thank you all for attending this meeting, and thank Krista and Lena for joining us.